got KU, we got Wichita State, we got Missouri, and then anybody else want to shout out to a university? Oh, Illinois. So we're all part of this community, and we've gone multi-state now, multi-university.
Yeah.
But Austin, thank you. Thank you for doing that.
And today is to give you some resources, but we also want to learn from you. So we know that you're out in the field, you're really the experts in your area, so you can really give us a lot of information. Because we, as Elaine mentioned, are developing this mobile app. And right now, it's really focused on, we got a lot of information from college students and what they want, what they need. But obviously, we want to broaden the impact, and we want to help people who may not have access to a university, right? We want to touch people's lives who live in rural areas, for example. That's another grant that Elaine, Amber, and I are working on. And so you're going to be really helpful for us. So we're informally going to be getting information from you all, learning from you. And so with that being said, I do want to introduce the team. So Elaine already mentioned Dr. Amber Vennum. And so she is an associate professor now at Kansas State University in the Couple and Family Therapy program. And Amber was actually my master's advisor, so I'm her academic baby, her child.
And I'm so proud right now. You're doing so well.
But she has some new academic babies that I'm a little envious of. That there's always some rivalry in families, right? But I'm just kidding, they're great. So we have Paige and Shelby, and so they're also in the Couple and Family Therapy program, and they've been really instrumentally helpful. What?
Shelby's that.
Oh, so she's at Family Studies?
I'm applied family science.
Okay.
So.
And we'll talk about that in a moment too. So the Couple and Family Therapy program is obviously more the clinical aspect, whereas Shelby and I are more on the research side of things. So I went from the Couple and Family Therapy program, seeing clients, to more of the research side. Which brings me to Jeremy Cantor, almost Dr. Jeremy Cantor, if I decide to pass him. Just kidding. You gotta keep him in line. Jeremy's great.
That's why I'm talking to parents.
Amber's really bad. So, not being very supportive. We'll talk about the importance of
Your
support.
grandmother loves you and supports you.
Yeah. So Jeremy and I are in the Department of Human Development and Family Science. And like I mentioned, I have an extension appointment, so I network with a lot of people out in the field, educators from the University of Missouri who go out and do family life education, relationship education, some poverty work. And so we flashed up this image here because this is from the K-State Couple and Family Therapy program. But I also like to flash it up because if you look really closely, I'm in the background, and like it's my only opportunity to be a model. And so I always like to show that off that I'm on the
I got your best side.
Yeah. They knew that it would scare people away from coming to therapy if they saw my front. So, sorry. If you want to go to the next slide. So we appreciate the work that Shelby, Paige, Jeremy do on the Relevate team. And there's a whole big staff that wasn't able to come today, but we have a whole big team. And we'll talk about a little bit more about what Relevate is towards the end of the talk, because it's hopefully going to be a really important tool that can be really helpful in your work and the work that other people are doing as well. But just to get started, we wanted to do a little icebreaker activity. We know a lot of you know each other, but we wanted to get to know you as well. So if you wouldn't mind just taking a minute to jot down 3 moments in your life that were really important, or 3 really big accomplishments that you're really proud of. Just take a minute to jot those 3, your 3 biggest accomplishments. Examples. Talk to the people around you and talk about who helped you make those moments special, those accomplishments special, or made them feel important. Other people involved. Did you hear my voice clap twice? I used to be a camp counselor. So now think about an opportunity when you were able to support someone else. And both the examples that we just talked about, so when other people supported you in your accomplishments, as well as times you've supported other people, I want you to talk to the person next to you or in groups of 2 or 3. What would those experiences have been like without those healthy relationships, without those relationships in your lives? go ahead. Thinking about are typically, so there was recently a study where a bunch of nurses were talking to patients on their deathbeds, and they talked about what are your biggest regrets or your biggest mistakes, and a common theme across them was that they had to do with relationships, right? When we're thinking back on our lives about what was the most important things, what was the most impactful, it's our relationships that we're thinking about. And what are we doing day to day? We're often talking about relationships, or we're navigating relationships, right? They're such a huge part of our lives. You can go to the next slide. So let's, hold on, go back. There you go. What are some benefits of relationships? Because I know this group, and we just had that discussion, and you were kind of throwing out some. What are some benefits that you know that people get from relationships? Maybe you yourself, maybe some of the people you work with. What are some benefits? Time. Blank impact on your health. Greater, equal, or lesser compared to exercise. Social support has a blank impact on your health. Is it greater than exercise, equal
Personal
to?
questions you're asking, or is this as a?
In general. In general.
Use your wisdom, but we might be checking our own personal opinions, right?
I will not be grading you, Mike.
I wish it were one answer, but I think the reality is different.
So you have 30 seconds. So is it greater, equal, or lesser than exercise? Okay, so let's see what the answer is. So it looks like most people put greater. About. Compared to smoking, social isolation is more, equally, or less hazardous to your health. Compared to pollution, social support has a blank impact on your health. Equal.
There's a learning curve here.
Most of the measures of social relation, or the stronger measures of social relationships, right? So that's smoking less than 15 cigarettes daily. The next one. So here you can see physical activity is that middle, and then BMI, which is what typically people use to measure obesity, even though it's flawed, it's not perfect. But you can see social relationships has a much stronger effect than physical activity. Now, do not use this as an excuse not to. This is just showing how important relationships are, but my coworkers, I have a lot of faculty coworkers in nutrition and exercise science who would be very mad if I didn't give that disclaimer. And then, of course, air pollution, which we know is toxic. We know that people who live in under-resourced areas, who live next to polluting plants, right, they have health risks. So we know that that is really critical. This is considered a public health concern, right? But I just want to show that relationships is stronger, which is fascinating. Right? Yeah. So before I get into the spoilers about how it's so powerful, let's look at something else we've hinted at. So this is the same people who just did that big meta-analysis about 7 years later, this just came out recently. They're talking about how funding is really focused on some of these other things that we talked about, not necessarily on relationships. They say it better than me, so I'll just read it. Despite mounting evidence that the magnitude of these associations is comparable to that of many leading health determinants, government agencies, healthcare providers, and public or private healthcare funders have been slow to recognize human social relationships as either a health determinant or health risk marker in a manner that is comparable to that of other public health priorities. So I mentioned before, a lot of those things I just compared it to were public health priorities. There's a lot of funding for those things. Rightly so, those are really important for our health, but relationships are too, right? And so I think one of the main reasons why people don't think of relationships as being really impactful, and why maybe people don't get as jazzed or think, oh, we need to fund this research on relationships or fund this program, this activity to improve relationships, is because we don't potentially make that case or that linkage, like what are the mechanisms? How does it actually affect our relationships, right? And so People in this room are probably aware of the social determinants of health, and we can chat more about those because these are especially critical in low-income populations in terms of why are people in under-resourced communities they have less access to health care, right? That's a big determinant of health. But our relationships affect that too. So just as an example, this is a great book over here that I've only read the first 3 chapters of it, but because I got very busy, and I'll explain that in a second. So first I'll give the example. We know that a concordance of health behaviors, meaning that if you engage in a health behavior, it's much likely that your partner, your friends are also going to engage in that same behavior, right? We think of peer pressure. Usually it's in the context of a negative, but we know it can also be positive, right? And so just as a quick example, my parents are both smokers. My dad quit smoking for a year, but my mom did not. And my dad talked about how hard it was to go out into the garage and see my mom smoking. He would smell the smoke on her clothes, and it would really make him want a cigarette. And so he gave in and started smoking again after a year of not smoking. And so that shows how powerful that is. I have to go running. My doctor tells me that my cholesterol is really high, so even though I don't enjoy it, my wife does not. She can eat whatever she wants and doesn't have cholesterol issues. God love her. So I was putting on my running shoes back when it was warmer. I use any excuse not to run, so I've been using the cold as an excuse. And I was putting on my running shoes, and my wife said, "Wouldn't you rather just sit on the couch and watch Netflix?" Yes, of course I would. And so I did. And so that was good for our relationship because we had some time to connect and bond over a TV show that we both liked. But maybe it wasn't the best for my health, right? And it's similar with food. It's really hard to just cook for one person. So unless our friends, our kids, our partners are wanting to eat that same healthy food, it's going to be really hard to give up, right? Like if my wife's going to eat a piece of chocolate cake, I want a piece of chocolate cake. And my friends in nutrition tell me a little bit of chocolate cake is okay. So. So that's just an example of how critical it is that we support each other in our goals, our health goals, right? We need to be able to facilitate these things. Another important thing, this is something that my wife is actually good at. So a year ago, I had a health scare where I had symptoms of a stroke, and the doctors thought that was really weird for someone who is 32 years old to have these symptoms of a stroke. And they thought that maybe it was apparently there's migraines that can affect the speech center of your brain, so I was having trouble speaking. And they related it to people who have ocular migraines where they go blind, right? And so it's similar to that. So I wasn't as concerned after they gave me that explanation, but they still didn't rule out a stroke. And so every 4 months, my wife is telling me, you need to go get a checkup. You need to go get another fMRI, another EEG. I wouldn't do that unless my mom, and my friends were encouraging me to go to the doctor, right? Because I feel fine, but they're right that I should probably go check that out. When I was a therapist, I had clients who talked about how their dad wouldn't take their cholesterol medication unless they told him. So our partners can be, and our friends and our family members can be good about helping us adhere to our medical regimens, right? We'll transition off and on here because I'm sure that some of you are already doing some of this work, right? You're probably training people or talking to people about relationships or maybe anything that you want to educate people on. What would you consider some of the more traditional approaches of how we either teach people about relationships or teach people about budgeting, finance? What are some things that you've seen done or you do or you think are done?
Traditionally?
Yeah, just like what is common?
Well, that 3-ring notebook with a lot of curriculum. I mean,
Right.
that's extension. We have extension people here, so yeah, we love that.
So having resources, giving people resources, which can be helpful, right?
Yeah.
Classes.
Unfortunately, I think, that having that visual aid for, and I can't speak for everybody, but for our group, that visual aid can be something. but the 90% of what they get is not so much the visual aid, it's the relationship
That connection, maybe
Yeah, it's
face to face with
connection
you mentioned
we form
class, Trish.
that we form with them to be able to convey, the changes they need to make, the improvements in their financial plan and things like that. It's got to go hand in hand with the visual part, but there's a lot of them, and I think especially in Harvard, that scares them. The school book aspect of it scares them.
I almost think like the head knowledge is the scaffolding, right? That then the relationship puts the meat on. So, you've got to have a, Dave Ramsey, here's your, sorry, I'm there, so this is what, but you've got to build that scaffolding, first baby step, second baby step, third baby step, here's what you're gonna be doing. But then that relationship with your partner saying, we're trying to save for kid college, relationship where that's what actually gets you to do the thing, the
So
relationship.
you're partnering, Trish mentioned earlier taking classes, which can be, if it's a large class, it can be hard to develop those one-on-one relationships, right? And so there's a lot of ways that this is hampered. So with our audience, typically we see, especially with under-resourced families, they have trouble getting to these classes because maybe they don't have the funding, they don't have childcare, they don't have gas money, they can't take off work, right? So it gets really challenging. And then for the sake of time, we'll just run through Relevate. You can probably do it faster than me, so.
It's bigger.
Okay, I guess I'll just do everything.
Haven't I done enough for you?
Oh, the relationship issues. Yeah.
This is the real parent-child relationship. So something that we've been working on is how do we get this information out to people who may not normally have access. And so we were thinking, especially with young adults, but even adults on average, are going online to seek out relationship advice as well as medical information. If we think about WebMD, I use WebMD, right? But some of that information may not be the most useful or most helpful. So just as an example, I want to flash up here. So this, we just looked up some of the most Googled terms, and just as an example, love is one of the most Googled terms, and you can see here, the red is American football, the yellow is Donald Trump. You can see that there's different fluctuations, so around you can see football season, people are searching and Googling football, right? American football. And you can see a blip there, probably, I would assume, the Super Bowl. The blue line is love, and so you can see it's pretty consistent, right?
But it's
There's-
at Valentine's Day.
Yes, there's a little blip that I think is around February 14th, right? So the next slide. And if you look up love, if you just Googled it, we don't have time, but we were going to have you Google terms that you might be interested in, like maybe cheating or conflict. And if you Google any of those, here we just Googled love, typically you'll get websites that aren't credible, right? That aren't research informed, that are usually just somebody blogging that are saying, this happened to me in my relationship, so let me give you advice about your relationship, right? So it's anecdotal, meaning it's just based on personal experience, but it can also be maladaptive. I see people giving terrible relationship advice all the time. And so we really wanted to counteract that. So we are developing a relationship education app that we have the website, but we're beta testing to create an app so that things can be more tailored. Because something else that's challenging in a class is that you typically have a one-size-fits-all approach, right? Where we assume that, I'm going to give you this information that's going to help the most people in this class, right? I'm doing that right now. But each of you are individuals with unique experiences that we need to potentially tailor or personalize, and going online is a way of doing that. But again, this isn't to replace those classes. I'm a relationship person. I think that face-to-face connection is vital, right? This is to augment that and to give more of a dosage of an intervention, so to speak, over time. Because if we just throw a lot of information, that can be really overwhelming.
For sometimes when we deliver curriculum, we're giving it to them all at once, but that might not be the time when this piece of information right here is most relevant to them, so they don't absorb that piece, right? We absorb what's relevant to us right then. And so part of what we're trying to do and explore with this website and app is, can we meet people where they're at a little bit better when they need it? And can we meet diverse needs a little bit better than kind of those one-size-fit-all packages?
And research shows that the gap between those who, like, between low income and more affluent communities in terms of smartphone ownership is decreasing. So that gap is becoming less wide. And we're seeing a lot of low-income families, under-resourced families going online to find this information for a variety of reasons. And so it's a way of helping individuals who may be reluctant to seek out services, for example.
And some of what we've found is when we package information about other topics with relationship information, people are much more willing to access it and receive it. So if we package health information with a discussion about conflict in relationships, or we package financial budgeting and issues with information about relationships, it seems more relevant to them. It's a little bit easier to digest sometimes than, oh, am I really going to read this article about budgeting? That sounds pretty dry. It's not very exciting. Oh, but if it's about how my relationship is impacting
I fight with my partner about budgeting, right?
There's a lot of intersectionality in all that too.
Yes, absolutely.
Yep. There's a lot of overlap with, right now in Missouri, the opioid crisis is really big, but we're seeing it's highly relational. Financial stress can create strain in your relationship, right? And so it gets tricky, but I'm just going to go back 1 second real quick. One way that we're able to tailor this is by we have users create demographic profiles. They're able to take assessments or
We
quizzes.
will, that's the goal.
Yes,
Not there yet.
so we have them take quizzes where we can find out what are their gaps in knowledge, what are they interested in learning more about. That way we can develop more infographics. So just as a quick example, or we can tailor content to their news feeds, I should say. As a quick example, in my room of if I'm giving relationship education, there may be something that's not relevant to everyone that wouldn't benefit everyone, so it'd be kind of a tangent, but there may be somebody in that room who that information at that time would be really critical. So just as an example, let's say that somebody puts their racial identity as black and they put that their partner's identity is white. We can tailor information about interracial relationships to them. Because again, that may not be relevant to the majority of people in the class, so we may not have time to get to it, but there are unique cultural expectations that maybe that couple should talk about, right? And so it's a way of providing that information, again, to augment what the wonderful work that you all are doing. So hopefully it can be a helpful tool.
So where are you getting these,
This is not up and running.
where are the facts that you present to these people based on, is it on research or?
Yes.
social-
Good question. So it's based, we want everything to be evidence-based, research-informed, and again, that's taking it back to when you just Google love, you get a lot of stuff that is not. That's terrible advice. We want to counteract that by making sure that it's research-informed, and so one of the things that we're doing is we're connecting with relationship scholars across the US and internationally to help us develop content, right? And so I went and spoke with Extension so that they could help not only with recruitment and marketing, but also helping develop this content. We want it to be very appealing. Like if I just describe that study to someone, it probably wouldn't be super helpful. But if we put it in a neat infographic, like this one over here is relationships and health, that might be more impactful for them, right? Because it's more fun. That's more fun to read than this, right?
So anyone, if you've got your cell phone or a tablet, you can go to myrelevate.com and you'll see the beginnings of what this could look like. Our website is, all the base structure is built, and now we're trying to find contributors, scholars, relationship educators, therapists, clinicians, who can add content that's research-based, that is written in a way that's accessible to public audiences. But we need part of what we're interested with partnering with you all about is to hear more from you about what would be helpful and what you think not only would be helpful to you in delivering information to people, but what you think your audiences need, your communities need, so that we can make sure what we're developing is something that's actually relevant and useful. Because I don't know everything that y'all know in my office.
So what is your target demographic for?
It started off pretty narrow, but we've been pushed to broaden. And so right now, part of what we're trying to do is create as much diverse information, gather as much diverse information as we can. So target demographic was originally, let's say like 18 to 35-year-olds. But we recognize, because of disparities in access to technology is least among those age groups, and we like to take kind of that early intervention prevention approach. But we recognize that the information there is going to be useful across the life course. And so we're trying to accommodate that. I'm not sure if that's what you meant.
Yeah.
Yeah.
Oh, I love this. Sorry. Playing,
Sorry, go ahead.
oh, no, the anecdote. Playing hard to get. This is my husband's dating advice. And
Did you find something useful?
oh, I did.
Now, Trish is going to go home and use that as a weapon, which we do not advocate.
So I may try to transition back to stronger ground community work. So what interested me as an ally, I'm an ally for our Thrive program here in Manhattan. When I matched with someone, I sometimes have a hard time knowing what to talk about, right? I sometimes have a hard time establishing rapport, but I can observe over time there's some relationship quirks that maybe my leader has that may hinder their ability to get a job or maintain a relationship, or maybe some of those relationship quirks are affecting their health or mental health. So as Amber and Kale and I were learning about all of this, and you guys were sharing with me and I was sharing with you, we thought, wow, could an ally be trained to use something like Relevate, and we could sit after dinner, because we have times to talk with our leader, and we could mutually talk about our relationship issues, relationship opportunities, and use this as a way for our people, at least in Manhattan, my leaders, to maintain some calm on the days where I can't get to them. Instead of feeling isolated and alone when their relationship goes south, could this be a way to self-soothe and cope while the ally is elsewhere? Because I can't be everywhere for my leaders. I can't. So that was one thing. If this app is something that they trust and they know that their ally gets it, then can this be that gap filler, Kale? I think you said that transition point.
And I think that's part of what we need help understanding also, is what would make a resource like this trustworthy and accessible and usable. Because the overall goal of Relevate and why it was founded was to reduce disparities in mental health outcomes, relationship outcomes, economic outcomes through the power of relationships. That's our goal. But we can't do it by ourselves.
So we could put a link to this website on our website?
Yes, so right now, Amber mentioned that there's not a lot of content. It's kind of the bare bones of what we want it to be.
Right.
But yes, that would be the goal, would be putting the link to the website as well as the app that and then eventually would be the goal to launch it so that it's downloadable for free.
So it does look like it's a lot of very intimate partner kind of content
Yes,
on there
so
right
that's
now.
another- yes.
So I mean, if you're asking for input, so I think friendship relationships would be
Yes.
very valuable. As well as that parent, I saw a few parent-child, but not very many.
Yes, so that
So
goes
those
back
would
to
be-
Mike's question about the target. And again, it started out young adults and romantic relationships, and then we were pushed to broaden it out, rightfully so. And so we're just now starting, so I have a colleague at the University of Missouri who does sibling relationships, and she's going to be developing some content for us
Very important.
as well. Yes.
And we were also thinking coworker, managing coworker relationships, but any other ones you can think of?
Adult child to elderly parent.
Oh,
Yes,
yeah.
that's
That's a
good.
good sandwich
That's very good.
generation.
Can I have a student take notes, please?
And Kale, Taya has something, but then this actually is the good jumping off point for our discussion groups. So Taya, you had something you wanted to?
No, I was just, when you're collecting the information, are you gonna reach out to some of these, groups like McPherson and Salina and do surveys? That way we can have our.
Oh, you're reading our mind.
Okay.
Actually, Taya did say the opportunity to have Amber and Kale and the team here, first off, is to listen to you. So that's why breaking up into the groups and those that want to talk about allies, that will be part of Leanne's group, and then leaders, Ray will lead that. Jennifer, who just stepped out, will lead a discussion on what is our state system, what is our state network, looking at state issues. Really, the community action program, folks who are here, you can decide wherever you would like to go. And then Austin and I will talk about program. But during those 45-minute breakouts, Amber and Kale and our students will listen and think about, well, this is a relationship piece that needs to be attended to. This is a potential avenue to integrate or work with health issues and actually blend it into what we're all doing out in our communities.